Well, they're at it again in the Virginia General Assembly. The Republicans at it yet once again with COPN. You know what COPN is? Certificate of Public Need. Like all these problems that we have in Virginia, here come the Republicans again. They want to get rid of or modify Certificate of Public Need, which means that you can't open up a medical facility within certain miles of a hospital unless you can show the need, because what happens is the Republicans call it free market. What it really is cherry picking the most profitable services to then put rural hospitals out of business. Because, see, I can open up a medical facility 2 miles from a hospital without a certificate of public need because the Republicans make it go away. And I can say, well, I'm going to offer these 5 services. But, of course, if you come in and need one of the services, you're not a hospital, so they can simply turn you away because you don't have insurance. But the hospital, if you don't have insurance, you go to the emergency room, and by law, they have to take you as indigent care. Therefore, there is no free market in the hospital business. Therefore, when you get rid of COPN, guess what happens? Rural hospitals go out of business, and then you have to drive 4 hours for a trauma injury, which increases your rate of death or brain damage, among many other things. But yet the Republicans are at it again, right? It's like a dog with a bone. COPN, get rid of it. It's free market. It's not a free market. That is a complete falsehood. It drives me insane. Joining us now to try to straighten this out is Sean Connaughton. Sean is the president CEO of the VHHA, the Virginia Health and Hospital Association. Sean, we have to do this every session. It drives me insane as a conservative when these Republicans come out and talk about the free market system in the hospital business when there is no free market. I mean, is it me? This drives me crazy.
Well, good morning, John. And obviously, this is something that we've been working at some time. And we've been supporting major reforms to the program. We supported legislation this year that make the program more reliable, more faster processing, and make it more predictable. And again, it was defeated. And instead, we're back here dealing with now legislation that's going to provide specific exemptions to help specific providers, which we don't think many of them, if any of them, have even applied for COPNs in the past. So now they're going to the legislature. They've gotten legislation written up with all types of caveats as to who can get it. So essentially, it's providing a direct conduit to get COPNs for very, very limited numbers of providers instead of dealing with helping us try to make the program better and faster and more predictable. I mean, it is every year. I mean, here's Virginia. I mean, one of the things we're very, very proud of this year, we hit the top 10 in quality. We are well below the national average in the cost of health care. And particularly when you look at the cost of health care in comparison to even those states that have done away with COPN. And we got a lot to be proud of. We want to work with the General Assembly to help make us number one in the country when it comes to quality and make it the lowest possible when it comes to the cost. And, every year we spend our time and effort dealing with this type of issue, and we just wish everyone would come together and work with us to help us get to where the common goal is high quality, low cost, and making care accessible throughout the entire state.
Well, and to do that, you have to protect it. Look, COPN, which is the Certificate of Public Need, is there for a reason. It is very simple. It is there to protect the more profitable services for rural hospitals that are on the edge right now of staying in business, okay? So here's where the Republicans on this drive me nuts, okay? They don't want public hospitals, right? They don't want to give the hospitals any money. They don't want the state to run them, right? They want private hospitals, right? That's the conservative way, free market way, private hospitals. But hospitals they don't operate in a free market, okay? If somebody comes to me, I operate in a free market, and they want to buy advertising. I'm excited, yeah. if I've got the right audience to help you out. But then somebody says, well, I can't pay for the advertising. And I have to take the advertising and eat up my inventory anyway, right? I have to do it anyway because there's a law that says, well, you have to take anybody that comes in for advertising. Even if they can't pay, you have to take it. Well, too many of those, I go to business, right? I don't have a job. So you have to take the indigent care. People come in to an emergency room. They don't have insurance. They don't have any money. You have to take them and care for them. That can be 10, 12, 15% of a hospital's entire operating cost. You get one of these companies, medical companies, so-called operating in the free market, right? And they come in and they cherry pick. They open up a clinic 5 miles from the hospital and they cherry pick the 5 most profitable services. But Sean, guess what? If you come in for one of those services and you don't have cash or insurance, what happens? You get turned away.
Yep.
Then you have to go down the street to the rural hospital, which has to take your sickness and make you better, do the best that they can through their indigent care system, which is mandated by the federal government. Now, you tell me how this is operating on a free market playing field.
Listen, John, I mean, so if you look at the state, about 2/3 of the people in the state are covered by commercial insurance. Mm-hmm. When you look at the actual users of the system, and this makes sense, 2/3 of the users of the system are in Medicare, which is, of course, for the elderly, Medicaid, which is there particularly for the highest cost drivers there are elderly and disabled, and then indigent. So we have 2/3 of the people are covered by commercial insurance. 2/3 are either Medicare, Medicaid, or free care. And think about these. We're talking about reimbursements. Right now, the federal government only reimburses you 88 cents on the dollar for Medicare patients. The state is only 71 cents on the dollar. And for indigent, it's completely free. And so going along with what you're saying, in fact, I had somebody just last week talk about the fact, well, then what you have to do is actually increase your volume. You know, if you can't raise your costs, then increase your volume. And like you just said, you want to go out of business real quick, increase your volume of patients who you're getting reimbursed 71 cents on the dollar. You're not going to be in business very long in providing health care to people when you're essentially taking a 30% cut on all your patients. I mean, it's crazy. And right now the state, we're hoping this year that they will start to address this reimbursement issue. But, I mean, right now we're getting 71 cents on the dollar of the cost of health care. And this is becoming a major driver in why your commercial payments are so expensive and why premiums are going up. And then, by the way, one of the challenges we're having is trying to get people to pay attention to the fact that this has an impact across the board and also has obviously an impact on significant public need, because our fear continues to be is that they'll take the commercial payers and those will end up, like you said, going out there to different other providers and leaving the hospitals. It'll go from 2/3 of the patients being Medicaid, Medicare, and free care to much higher, and then eventually leading to serious business disruptions for the people of the Commonwealth of Virginia.
We have to go through this every single year. This is legislation in search of a viable application driven by lobbyists for medical provider companies that don't have to operate under the same indigent care rules as a hospital, that want to come into areas under the guise of free market, under the aura of capitalism or whatever else that the mantra they have, when really what it is profiteering and cherry-picking profitable services at the ill-being of hospitals that are operating on a thin margin in rural areas trying to get by. And when this has happened, like in Georgia, guess what happens? Rural hospitals go out of business, right? They just close up, and you can't do anything about it because, see, they're private companies, and you only lose money for so long, and they simply throw up your hands and you shut their doors. right? And then what does that mean? That means that the hospital in the rural area, like that happened in several areas in Augusta when Georgia repealed the COPN laws in southwest Georgia, they closed down. And now instead of driving 35 or 40 minutes to a hospital, you have a problem, you're driving 3.5 hours, 2.5 hours. I mean, the same thing is going to happen here in Virginia. And we already had one hospital closed. These rural hospitals operate on the edge. And so to take away their most profitable services where they stuck with the other, because what the medical practitioners come in is they cherry pick the high profitable services and then they underprice the hospital because they don't have to provide anything else. So they're able to do that under cost. And somebody can say, well, I saved money there. Yes, but it's a whole picture you have to look at, right? It's a balance.
Yeah, I mean, when you end up having an accident and you show up at that emergency room, you want to make sure that that's well-staffed, that has people to deal with any emergency. I mean, sometimes I don't think people think through about the costs that to have an emergency room and a hospital staffed 365 days a year, 24 hours a day, 7 days a week, and the fact that they're prepared for anything. They're prepared for somebody showing up with the flu to major, major community events, man-made natural disasters. And when those disasters occur and people start showing up into that hospital, you want to make sure that they're ready to deal with that. And the problem is that, like you said, I mean, a lot of those who are attempting to break down this system that looks at the entire picture in providing health care to a community, those trying to break down are going to end up, they're 9 to 5, Monday through Friday operations. Try going there on a Saturday where you end up, if you have some sort of emergency. And this is the challenge we keep on trying to point out to people, is that you have to look at the entire picture and what hospitals are there to provide to the community. And somebody has to pay for those. And quite honestly, we have a hard time getting through to many legislators to make them understand that, if this capability goes away, once it leaves the community, it is almost impossible to come back and to restart it. And right now we're working with some of the legislators on a hospital out in Patrick County that was owned by one of our members that went bankrupt.
That's right.
And that community is working diligently to get the hospital open in the near term.
Right.
Because they know that once it's closed and stays closed for any sort of length of period, it ain't reopening.
Right.
And they're afraid for their future. They're afraid for their community. What happens to that when that hospital is gone? And we talk about economic development. We talk about trying to get jobs into the rural areas. No one is going to locate a company or any sort of economic development project if they don't have good health care and if there isn't a hospital in that community.
Sean Connaughton, you're absolutely right. And when you look at COPN and rural hospitals and the whole thing, it reminds me of the movie The Lion King, right? Remember that? It's the circle of life, right? I mean, yes. That's what this is. It's the circle of life. And you have to give rural hospitals the opportunity to make money in certain areas where they can be profitable so they can offset the costs where they can't make money in order to care for people that are on Medicaid or don't have any insurance at all. It is as simple as that. It's simple math. Hospitals do not operate in a free market environment. So to repeal any parts of the Certificate of Public Need or COPN is absolutely asinine. It makes no sense, and it defies our medical circle of life. Sean Connaughton, I'm out of time. Thanks for being with us.